Good morning and welcome to Tennessee Valley this morning. We're just so glad that you're there going to watch us today. And I'm Kay Free with Keller Williams Realty, your hostess. And, of course, my great co-host, my sidekick, Mr. Chris.
Good morning.
Good morning. How are you this morning?
Doing well. Doing well. I'm like the time change.
Oh, I do too.
Get a little extra sleep. Well, we did one night anyways. We were
well,
early
I get
to
up
church
earlier.
Sunday morning.
It's easier to get here for the 6:30 show, right?
Well, yes, it is.
It is.
Yes, got a little more sunlight and those things, so it makes it nice.
I
makes
think
it nice.
so.
I like that.
There's a lot been going on in the last couple of weeks since we've been here.
Oh, yes.
We were off for about, 2 or 3 weeks?
We were off for 2 weeks, I think
Yes.
it was total.
Yeah.
We had that.
So here we are back, and we've had I had a great weekend.
Yes, it was busy. It was a good weekend.
Had guests come in, and then at Lee University they had their 50th year reunion with a musical with over 500 voices singing, and it was awesome. I don't usually go to those. You know, when you live here in town, you just sort of, oh, well, Lee's having something else or whatever. But
it was
anyway,
a good program to go
I
to.
went. There were friends that come in to sing in the group, and it was awesome.
That is, well, you said you were going, but I didn't know.
Yeah.
Didn't know what it was.
Oh, it was very good.
Well,
very
good.
Well,
Well,
and when
wonderful.
you take 500 so voices, the cream of the crop, and you put all of those voices together with maturity that they've had in the last 50 years and put it there, it's an awesome, awesome sound. And musicians that were just incredible.
So it wasn't just people that are there now; it's people
they
alumni.
came in. The alumni came
They
in.
to sing.
Absolutely.
Oh, wonderful!
Yes,
How
it was very
nice.
good. It was packed out, and then they sang at Westmore Church of God, I think Sunday morning, and had a great time. I did not fight the traffic to do that. I thought I heard them Saturday night. I'll let someone else go here on Sunday morning. So
That is awesome.
so I didn't go there.
That's awesome. Well, thanks. We had Halloween just finished up. All the kids,
Yes.
everybody had, and actually the weather actually turned out not too bad. We were afraid of rain, but it actually turned out not too bad. A little.
I
sprinkling,
live in
but-
Lakewood, and they actually bus the kids into Lakewood. I have never. We
Well, they
hardly
had it
ever
lined
see
up.
any
They had it
children in
lined
our
up at our
neighborhood.
neighborhood too.
I mean,
our road didn't get as much, but the front part of the neighborhood.
Everhart,
did.
yeah.
they come
I
over
tried to
there.
go to your house. I like to never got in your driveway.
Yes, it was busy over there.
I know, when it's good weather and the kids were out, and the candy was just going, wasn't it?
My kids enjoyed handing out candy.
I know.
I think they like
the
that
5-year-old said he didn't want to go trick or treat. He'd rather pass
No,
out.
he'd rather
share the candy.
Share the candy, he said, with the others that came to the door. So it was a lot of fun.
He was an Indian, and he looked incredible.
He was very cute. He did a good job.
He wore it all day, didn't he?
Yes, he wore it all day long. and
And
would probably wear it
would-
another day if we'd let him.
I was going to say he probably would. And then we went to Madeline had a dance recital
Daughter
or
had
a spirit
program.
program.
Yeah, they had
and
a program down at her dance where she takes dance at. They had a program there, and they had, I think, Cleveland Middle School's
Yes.
dance team was there, and some of the other dance teams from the area were there.
from Chattanooga and Georgia,
Chattanooga
and
things,
they were
from the schools.
incredible.
They-
Those
she got
kids
to
can really
perform.
dance.
Yes, they're very talented.
Yeah,
A lot
it
of good-
impresses me.
Yes. And
When I do well to walk, and I watch them dance. It's like, how do you get your body in that shape?
How to do
and
that, yes.
configuration, you know.
Yes, they do a good job.
I
It was
know.
very, very entertaining.
And then you're working on Nutcracker.
Yes.
With the family?
Yes, the whole family. Well, Oliver's the only one that's not in it. We asked
And
him
he
to
chose
be,
not to be
He
there.
chose not to be, but
He'd
we're
rather
all
share
helping
the
out with
candy.
that this year. So yes,
Okay.
they keep us busy with that on the weekends, and so that'll be nice coming up first week in December.
Okay.
Coming up, I can't
And
remember the
today
date,
we have an incrable show.
lots of good people on the show today. Very
I know.
Good show.
We have Sandra Kay Williams coming, and her friend Kathy Rockwell. No, Tammy Rockwell. Hey, listen, I don't have any notes, and
We
I'm
don't take
old. How
notes.
do you
We
expect
just-
me to remember all these things? And then we have Mr. and Mrs. Hughes, Wendy, and her husband
Yes.
from insurance. And listen, if you are interested in Obamacare and all that's coming up with insurance, like we haven't really heard about it lately, you know, they're going to be here to answer a lot of questions for you. And before we came on air, I was asking him some questions about it all. And it's most interesting because I just don't keep up with that thing, and I wait for someone to tell me, and he's full of information. So they're going to give you some good information. So stay with us. Don't go away. They're going to be our first guest. after a commercial break in a little while. And then Ruthie Forgy is with us from Salvation Army, and she's going to talk to us about its bell ringing time again and so forth. So we've got a lot of good things to talk about. And Sandra Kay, and they're going to talk about Haiti, and you'll want to hear what they have to say about the project that they're working on for Haiti. So we have a lot of things coming up. You don't want to miss the show today, because it's not just Chris and me today. We have some really great people on, so you want to watch them.
That's right.
Tell people about what we do for a living. This is our playtime, really.
Yes, we do this. We're volunteers, I guess, for this,
yes.
aren't we? That's right. And we don't get a paycheck. At least I haven't seen one yet, or I'm missing it in the mail. I don't know.
I didn't give them your address.
You didn't give my address? Okay. And, we do real estate. That's what we do in our real job and what we do during the day. And you can reach us online at chrisfreetn.com. That's chrisfreetn.com, or reach Kay online at kfree.com. Or you can reach us on the phone at 423-961-8095. That's my number. 423-718-6967 is Kay's number. And we help you buy your next dream home. We help you sell your home to find that next dream home, and everything in between.
That's right. And if you need a loan, call us. We can
point you in the right direction if who you need to go to do those things, and help you guide you through that process. That's what we do.
24/7, right?
It is a job. It is a 24/7 job. You don't have holidays, and you're always on call.
That's right.
And so that's just the way it is.
And it's fun because you have new people all the time. You bring in family members, and you stay with them for about a period of 6 weeks or so, especially when they're buying. And then we let go, and there's another one that comes in through our life. And if we list your house, it depends on how fast it sells. We may be your friend for a year.
That's right, depending on the type of house where it's at.
I know. So
that all depends.
And what's the most important thing about selling a house, Chris?
Is your price.
You
can do something about. You can't do anything about your location and things, but
you can a little bit about condition.
But
the price is the number one thing. The number one reason homes do not sell. So you sellers out there, take that and think about it for a while. And I know. And the other thing is, you cannot sell memories.
Nope.
You know, and a lot of times we put so much value on memories that we have in the house that we're in, or the properties that we're living in, and you can't sell that to your neighbors or your buyers. They just don't buy.
Because they have their own memories.
They have their own memories and their own family they want to bring in and start new ones. So just remember those things when you're trying to sell, because those will help you tremendously if you take those into consideration and do a lot of thinking and heart searching and numbers with that. And that'll help you sell your house much quicker.
It sure will.
Because we've had them to sell the minute I've gone in to list a house, know that I have a buyer for it, and I'll call them and say, come and look at it right now. And I'll do the listing paperwork and the selling paperwork at the same table. So, you know, if they're priced right and so forth, they'll sell quick. If they're not, you can have them hanging on for years, right?
That's exactly right. There's some
I know.
there.
I've got some on my listings that are
been there a few. And they just...
Well, they're not homes. They're commercial property, but that takes longer sometimes anyway. But just know that. Watch the price on it.
That's right.
And if you need somebody to help you, they don't come any better than Chris.
Oh, well, thank you. Okay.
Thank you. I was hoping he would come back and say that. You never know.
We don't script anything, so it's all.
It's all here for us.
That's right.
Okay, listen. What we're going to do right now is go for a break, and we're going to be right back with Mr. and Mrs. Hughes and insurance. And you want to stay tuned to us. Okay, grab a cup of coffee. We'll be right back.
Town Americana, where trucks are big and bold, and a handshake is firm, and your word is gold. Don Ledford Chevy Buick GMC in Athens is a $2,000 drive. Maybe you're coming from here or here, doesn't matter. Buying a truck from Don Ledford in Athens will save you at least $2,000. Don Ledford Chevy Buick GMC in Athens, a $2,000 drive worth making.
I'll take that drive every time.
At Crawford Pharmacy, we offer custom compounding. Our pharmacists are known for their attention to detail and unique expertise. So visit us at 2260 Chambliss Avenue, Cleveland, Tennessee. For personal assistance, walk right in or come up to our convenient drive-thru. Crawford Pharmacy, serving our community one person at a time.
Kyle Motors, 802 20th Street Southeast in Cleveland is the place to find quality pre-owned cars and trucks. Kyle offers on-the-spot financing on all vehicles on the lot. Each pre-owned vehicle goes through a complete inspection to make sure each car and truck meets the Kyle Motors standard. Warranty and extended warranties available on all vehicles. Kyle Motors will sell you a car or truck that you will be proud to drive for many years to come. See Tony, Bill, Dale, James, or David and let them put you in your next quality pre-owned vehicle. Kyle Motors, 802 20th Street Southeast. Phone 790-7100.
Are you having trouble filing for disability?
Seems no one is concerned about your pain, the waiting, the denials.
While some representatives will meet with you in court, we will meet with you now to discuss your plan. We'll review with you the same file that the judges will see. Call us now, Social Security Law Center at Logan Thompson.
You're entitled to better.
This segment of Tennessee Valley This Morning is brought to you by Crown Chrysler Dodge Jeep and Ram, located at 511 South Lee Highway in Cleveland and 2120 Chapman Road, Chattanooga. For your next new or previously owned vehicle, make it Crown Chrysler Dodge Jeep and Ram, the better way to buy.
That cup of coffee and are sitting back because we have the Hugheses with us with Hughes Insurance. And what a joy it is to have you this morning, because you're not only going to answer questions for the ones that are watching, you're going to answer questions for me today, because I know nothing about insurance. And I think the first thing we want to talk about is Medicare.
Medicare, the annual election period is October 15th to December 7th, midnight. So we've got 34 days left. So most seniors that are over 65 know this period each year. A lot of people refer to it as the open enrollment period. So whatever plans they are presently on, they have this opportunity to make any changes to those plans, whether it be prescriptions or Medicare supplement, whatever it may be. So it's a review time for them.
Okay, and is there anything you can really promise us other than our money going up? Our policy's going up. It is my money going out and the policy going up.
Right. I mean, you've got to look when you're choosing a Medicare supplement. Basically, a lot of people know it as a Medigap plan. And what it does, it pays what Medicare does not pay, okay, as long as Medicare has approved those charges. Then you have a Medicare Advantage plans, which you get low premiums, but then you have copays. And so you have a max out of pocket, trying to summarize that. And then, of course, you have all different types of prescription drug plans out there. It depends on what prescription you're taking, what drug formulary it's in, and the cost of those plans. So this is the time of year that's very important for people that are on plans to sit down and review and potentially make changes, because if they don't, as of December 8th, they're locked into that plan for a year.
Okay, and you do Medicare supplement plans, right?
Yes, ma'am.
And what company do you?
We are
you're a broker, so you do.
We're brokers, so we represent pretty much every major carrier out there. We will only represent A-rated companies or better. Ratings mean the financial strength of that company to pay claims, so we only want to represent reputable companies.
Okay. On the drug plans, is that separate? Do you have a different drug plan than you do an insurance medical plan?
If you purchase a Medicare supplement that we talked about first, then if you're wanting prescription drug coverage, you're going to purchase a standalone drug plan. And there, like I say, there's actually quite a few plans out there and options that people have. If you purchase a Medicare Advantage plan, which typically we call MAPD, Medicare Advantage with Part D, the prescription drug is already included in that, and you would have to go by their formulary, whatever carrier you chose.
Okay. Is there, of course, I guess it depends on what you really need for yourself, and the price does go up as you're aged, right? The older we get, the more we pay. Is that the way it goes?
Medicare supplement policies are, most of them are based on attained age, so obviously if we're living, the cost is going to go up. Medicare Advantage plans have nothing to do with age. Some plans, there you can get plans as low as $0 out there. And they're very good plans. And then you have plans that actually cost money but have nothing to do with age whatsoever.
Okay. See, I just do not understand insurance at all. It's just.
Okay, that's okay. That's what we do.
That's what you do for a living, right? I know.
Absolutely.
And while we're talking about it, why don't you give a phone number where you can be reached, and we're going to talk some more.
Okay.
But this is a good time. Somebody might want to take the time to write down a number.
Absolutely. 664-4203, and we're located at 4160 North Ocoee Street.
Right next to Free Chiropractic.
Right next to Free Chiropractic. So if Dr. Brandon was here, he'd just thank you real good for that, wouldn't he? But anyway, on the Medicare and the supplements, will we still have a choice of doctors, or do you know that yet, or is that in the plan? Are you familiar with what?
What you're doing on Medicare supplements, if you may see any doctor, any hospital in the United States, as long as that person accepts Medicare. Okay. Now you're beginning to see just glimpses of it, of doctors not accepting Medicare as much as they used to. The reason for that is the Medicare reimbursement rates from the federal government are decreasing.
Yes.
So obviously they don't feel like they're getting the compensation they need or deserve, and so a lot of doctors, what I'm finding out is saying, I'll take care of my existing clients, but I'm not going to accept any new patients. Now I'm not saying that with all doctors out there, but you want to make sure that you check. Now if it's a Medicare Advantage plan, it works similar to our group plans. If you have group insurance or bought an individual policy, you have a network of doctors. So before you choose a plan, you want to make sure that your doctors actually accept that plan.
And that's what you do.
Yes.
You can check all of that and make sure that they're are covered for any diseases or whatever they have. Now, is there a waiting time if you have a pre-existing condition?
No.
No.
When you move into Medicare, obviously if you're turning 65, you have an open enrollment period, so there's no health questions.
Okay.
And
the supplementary one is
correct.
Okay.
There would be no waiting period on that.
Okay.
There are some carriers out there, if you have not had coverage for 63 days of credible coverage, that would have you have a waiting period, but most of the people that we see are coming in off of some type of plan.
Okay. Wendy, do you know anything about insurance at all?
A little bit.
She's sitting over there so quiet. I've just wondered, you just take care of the books and the phone and all that good stuff?
Well, I'm actually a licensed agent. My daughter
Okay.
and son are both licensed agents in
Okay.
the office. If you call the office for anything for the Affordable Care Act, Lindsay and myself would be the ones that would help you with that.
Okay.
So yeah, we know a little bit.
You know a little bit about it?
I
Okay.
have to stay around.
Well, I thought so, and I knew you worked in the office, so
Yes.
because Susan, our friend Susan
Yes.
Baggett, talks about you a lot, and in a very positive way.
Okay,
So I feel like I know you because of her conversations.
Okay.
But now let's go on to single people getting insurance, or let's go to another subject of insurance. Not everybody's on Medicare, you know. I think they are, but they're really not. All my friends are.
Well, we have the Affordable Health Care Act that is actually going to go in full swing January 1, 2014. And if you have a plan now, whether it be, if it's an individual plan, obviously most of those plans are going away in most cases, unless you're on a plan that was before the law passed, which was March 23rd, 2010. But if that plan changed in any way after that date, then you're going to be kicked off that plan. And that's what you're hearing on the news a lot, of people losing their plans because there's been some type of change made, even if it was a $5 on their deductible. I'm one of those people that will lose the plan that I like, but I'm going to be removed from that plan and have to pick up an affordable health care plan. So obviously a lot of people out there possibly may qualify for tax credits, or government subsidy is what they call that. That's where the people will come in. When we say affordable health care, it will be affordable for some of those people. But more than likely, middle class up, it's going to be difficult for it to be affordable, because if you do not qualify for tax credits, what I'm seeing right now is prices are close to double, okay? And you might ask why. The biggest thing is, if we took let's say we take a man who's age 60, he's single, He doesn't need maternity coverage, but he's going to pay for it. He doesn't need birth control pills, but he's going to pay for it. It's basically a cookie cutter plan. And so a lot of people are going to be paying for benefits that they do not need, so therefore it's going to make the cost rise. It's kind of like you and Chris are in the real estate business. I can tell you everything I want in a home, and you probably can get it if I'm willing to pay the price for it.
That's right.
So that's what we're going to be getting in healthcare. There's going to be several options that you're going to have, and if you want the Cadillac version, they'll give it to you, but you're going to be willing to pay for that.
I was talking to my granddaughter. She and her husband will graduate from med school in May, and they're in rotations now, so they're working with the doctors and all this. But the thing of it, they said so many of the doctors are going into the hospitals to work for the hospitals. So therefore, I think maybe, I may be right, I may be wrong, I don't know, I'm just talking, but a lot of the private practices will cease to exist in some areas.
Well, you're going to see primary care doctors that are older that are going to retire and get out of the business. We already know of several that are doing that. You're going to see a lot of the younger people that are going into med school that are going to think twice about doing it. Because again, the reimbursement, what they're going to get paid, is going to be pretty low. And we know those people that go to med school have $200,000-$300,000 in loans, possibly even more. So that's going to make it difficult. Now, in 2016, we're going to see probably across the United States at least 60,000 less PCPs. And that's our primary doctor that we see. A lot of people in med school now are going into some type of specialty. But most if you get sick, you're going to go to your primary care doctor, not a specialist. So that's what we're going to begin to see if this law stays totally as is. We're going to see more people waiting to get an appointment for a doctor.
Yes.
And again, you're going to have people making some decisions on health care of what you can and can't have down the road. So there's some good benefits to the health care reform. I've always said I thought we did need health care reform. I wish what we would have done, though, is instead of it being a political thing, is it be bipartisan. We would have brought some doctors in, we would have brought some insurance carriers in and say, okay, what can we do that will help Americans, not what will necessarily help a political party.
I agree with you wholeheartedly on that. I think there was we needed to revisit the insurance companies and what was going on and et cetera. But to mandate is something this country's never been accustomed to. And a lot of people, I think, are not liking that. You know, it's choice. We've always had a choice, and I'm concerned about that part of the health care and the way some things are going. But my granddaughter was talking, she said, you know, I should have gone into veterinarian. Being a veterinarian, there's no health care and you get paid right then, you know, there's no insurance, there's no nothing. But anyway, it's too far down the road to change and go to animals. So they will continue with the humans and take care of it. But I think that our health care and to be educated in it is such a great thing, because most people I would think, are like me. We don't know it. We've never been there a lot. We just took it for granted, and there we were. The other thing was, you can be, if you all are interested in what he's been saying and what you need to know and to call, Chris will have it on the website. You want to talk about that?
I'll have a link on the website with show notes with their information on there at chrisfreetn.com. And that way we'll have information about them there that you can call and contact if you have questions about your Medicare supplement. And then with the Affordable Care, if someone has questions about getting an insurance policy, they can call you about that, and you can help them with get a policy through you also for individuals and things.
Sure can. And I think Wendy can tell you kind of what she's told some people about how important it is to actually talk with someone you know. I'm going to kind of let her cover that with you.
We do encourage anybody who makes the phone call. Right now they're telling you the sites are still not working. In Tennessee, ours are not working well. Some of the other states are. But if you do call, make sure you ask whoever you talk to for their license number or their NPN number. That's their national producer number. There are a lot of people who are not qualified, we'll just leave it like that, to answer your questions, and you have no promise of privacy. So you're giving financial information over the phone, and they're not promising that it will be safe at all. So you need to have a license number or go to somebody that you know that's reputable, that you can trust with your information.
Wonderful.
I hope you all have enjoyed what the Hugheses have given us today about insurance. I know it's been educational to me. And on the website, you will find their information. And you want to give your phone number again? We've got just a minute or two, just a second or two.
Absolutely. 664-4203, and thank you for having us today.
Hey, it's a pleasure, and thank you for being here. And so if you need insurance, these are the people you need to talk to and need to see. Thank you, and we'll be right back after this commercial.
Town Americana, where trucks are big and bold, and a handshake is firm, and your word is gold. Don Ledford Chevy Buick GMC in Athens is a $2,000 drive. Maybe you're coming from here or here, doesn't matter. Buying a truck from Don Ledford in Athens will save you at least $2,000 bucks. Don Ledford Chevy Buick GMC in Athens, a $2,000 drive worth making.
I'll take that drive every time.
At Crawford Pharmacy, we offer custom compounding. Our pharmacists are known for their attention to detail and unique expertise. So visit us at 2260 Chambliss Avenue, Cleveland, Tennessee. For personal assistance, walk right in or come up to our convenient drive-thru. Crawford Pharmacy, serving our community one person at a time.
Kyle Motors, 802 20th Street Southeast in Cleveland, is the place to find quality pre-owned cars and trucks. Kyle offers on-the-spot financing on all vehicles on the lot. Each pre-owned vehicle goes through a complete inspection to make sure each car and truck meets the Kyle Motors standard. Warranty and extended warranties available on all vehicles. Kyle Motors will sell you a car or truck that you will be proud to drive for many years to come. See Tony, Bill, Dale, James, or David and let them put you in your next quality pre-owned vehicle. Kyle Motors, 802 20th Street Southeast. Phone 790-7100.
Are you having trouble filing for disability?
Seems no one is concerned about your pain, the waiting, the denials.
While some representatives will meet with you in court, we will meet with you now to discuss your plan. We'll review with you the same file that the judges will see. Call us now. Social Security Law Center at Logan Thompson.
You're entitled to better.
This segment of Tennessee Valley This Morning is brought to you by Crown Chrysler Dodge Jeep and Ram, located at 511 South Lee Highway in Cleveland and 2120 Chapman Road, Chattanooga. For your next new or previously owned vehicle, make it Crown Chrysler Dodge Jeep and Ram, the better way to buy.
And welcome back to Tennessee Valley This Morning. And as you see, the Hugheses have left from insurance, and now we have Sandra Kay Williams. Thank you for being here, Sandra Kay, and Tammy Rockwell. And they are here. They have a project going concerning Haiti. And when I read the article, Tammy, that you sent me, it was just incredible, the things that are that's happening, the thing that is happening in Haiti with our young children. And Sandra Kay, you want to start off and tell us what you're doing and what you call it and how you got involved in it and et cetera.
Sure. And thank you so much for having us, Kay. It's a pleasure to be with you and Chris this morning. We have a Women with a Mission project with the International Church of God offices for our women every 2 years. And this 2-year period, our project is Operation Freedom, rescuing the servant children of Haiti. And the foundation that we are supporting is called Restavec Freedom Foundation. It is founded and directed by Joan Kahn. Kahn is a pretty common name here in Cleveland, so you may know her. But she is trying to eradicate the Restavec system. And the Restavec system is actually a child slavery system in Haiti that's been around for hundreds of years. Unfortunately, when the African trade slave trade ended in 1807, this practice did not stop in Haiti, and it is exclusively underage minors that are being used and abused, and we want to see them freed and to change the mindset of the nation. It's already illegal, but the government does not enforce the law. So Joan is wanting, like William Wilberforce of the 1790s, to change the mindset of the nation, and to that end, she is providing a justice curriculum to be shared in churches and schools, and she advocates for 800 students right now, trying to make sure that they get education. These children are deprived of education. They are deprived of love, of family. In total, there are about 300,000 of these children. That's 1 out of 15 children are enslaved in Haiti today, in 2013. It's just so hard to believe. But that's happening. And so we're raising funds to help her with a transitional home and with some of the needs there. She's providing education. She's providing so many wonderful opportunities, even literacy. And this gives them an opportunity to gain influence, to change this idea that children are just for use and abuse rather than to be cherished, respected, and loved like human beings.
Okay, and I was reading an article, I think, that Tammy sent me this morning, or yesterday maybe it was, and I was reading it this morning, and it was talking about children. The parents feel like that if they give this child over to someone else to raise, they're going to get a better life. Was that what I understood?
Right.
And then they take these children and really slavery, young children that work and serve and do all the hard work and then are fed very little crumbs or what's left over, if there's any left over, plus rape and abuse sexually. I sat there and read it, and I'm thinking, these are young kids.
Exactly.
You know, the parents feel like they need a better life, and they put them into this environment.
Right.
It was just, and I'm sure you can tell things, and Tammy, you also, about more than what I had the opportunity to read this morning.
Right. Tammy was recently in Haiti, and I'd love for her to share maybe a couple of the stories of these young girls that she met, because she came back a changed woman.
Yes.
She is so passionate about this cause, and she has organized a 5K run right here in Cleveland this coming Saturday, November the 9th at 8 a.m. at the Rolling Hills, what used to be Rolling Hills Golf Course,
Yes.
the Westmore property on Candies Lane at 8 a.m. And she is doing all the work and the organizing and has done a fabulous job of raising awareness here in Cleveland about the Rest Effect system, and to hopefully get young people involved in making a difference for these children.
The 5K that she mentioned Saturday, it is going to be at Rolling Hills, and we're still taking registrations. We're actually still taking, until close of business today, business sponsors for the 5K. It'll be $25 for adults and $20 for students to run in it, and the money is going to go towards the house that they're building. There's a house that they lease right now in Port-au-Prince. This house that they're building is in Port Salut, and Port Salut is in a totally different environment than Port-au-Prince. It's more rural, but it's cleaner, it's safer. Security-wise, it's probably going to be a lot better for them, because Port-au-Prince is just packed and crammed and dusty.
I was there several years ago, so I have a concept of what.
So currently they have, I believe it's still 13 girls. Age range is 11 to 18 that they work with, and they make sure these girls all go to an American school. One of them that they have, a lot of these kids, when they get them, they've not been in school in several years. And it's amazing how quickly they catch up, because one of the girls that they had that had been out for probably 5 years, I guess, is going to school, is on level to graduate on time, which you see a lot of kids, they're graduating at 21, 22, and she will graduate probably 18, 19. And they just took state exams, and she made the top score in her school. And that's a really huge accomplishment. And all of the girls that took them, there were 3 that took them right before I'd gotten there, because we took them out for pizza while we were there. Joan did, and because 3 of them had passed their state exams. But they're providing a lot of opportunity for these kids. One of the girls is young and had just gotten there. She's 13, and Joan said she couldn't remember a time where she had not been a servant. She had always been a servant. And she had been raped. Her story is just gut-wrenching. She was raped and became pregnant from it. And so, at the age of 12. And so these kids don't have value. And seeing them, you can look at the face of a child who just got into the home versus a child who's been there for years and see the difference, because they're happy, after they've been there a while, and they're like a kid, they're like a normal teenage kid after they've been there, and they know what it is to be loved and have security, and safety is a huge thing because they've not had that.
Do you, Sandra Kay, you have funding coming from all over the United States into your office, into what you're in charge of with the women?
If you'd like to give, maybe you can't run or even walk the 5K, you can donate at womenofpowercog.org and just indicate it that it's for Operation Freedom. We definitely are raising funds. In fact, over the last year, we've raised $150,000, and we hope to raise at least that much, if not more, over the next year. And then the total combined 2 years, we're hoping to get a corporation to match the funds that we have raised, which will be a considerable sum total. And so we're very excited about that.
And so the money that you're raising is for building the schools and
the transition home. It's like a safe house for these children to receive education. Earlier I mentioned about her efforts to change the mindset of the nation. I just want to let you know that is happening. When she started this in 2007, it just seemed like an impossible dream. But the Lord has helped her, and she has made a commitment. She believes that in her lifetime that this practice will end. Not that it'll just be outlawed, because it's already illegal. They just don't enforce it. But so much so that even the thought of it would be scorned and thought, that's terrible, so that this can really change. And so one of the things that I've tried to do with our women's directors that are raising funds is to ask them to commit to fast and pray, because it's not just money that they need. It takes a change of heart for this to really happen. For Joan to see her dream come true in her lifetime, it's going to take a change of heart. And so these women have have joined me in fasting every Tuesday morning. I'm so glad this is Tuesday morning. Every Tuesday, at least 1 or more meals a day for Restovac Freedom Foundation. And I believe that God is moving. And Joan just sent me a testimony last week that was amazing. She it's hard to believe this, but there are Christians, or those who claim Christ, who own Restovac children, much like our plantation owners in the South years ago, who said, oh, we treat our slaves real good, and thought themselves to just be so righteous. And so what she's tried to do is get into the churches. And just this last week, a testimony came in about a pastor who said, for years, I have been dressing my kids up and taking them to church and leaving my Restovac at home to cook the Sunday dinner. He said, I realize now that I need to treat that child like a member of the family. These children don't eat at the same table. They are not loved. They are not cherished or treasured or respected. And now they're seeing, after this training, after this, the efforts that she's made, that congregants are beginning to bring these Restovac children to church. So it's working. There is hope that in Joan Kahn's lifetime, the Restovac system will be eradicated.
That is awesome. And the cons have been working there in Haiti for some time, have they not?
Since 2007.
Yeah.
And so, when you consider how many years it took William Wilberforce there in Britain to change the mindset and to get the law changed, from 1893 to 1807, she's halfway there, because she started in 07. And if she continues, I truly believe that this will end very soon.
Well, for those of you that have never been to Haiti, which would be probably most people,
right?
there is no way you can imagine what it's really like there. And then to know that these children are taken in by the more wealthy. They're not wealthy, but with a little better means than what they have. And to see how that city operates is just, I just could not believe it when I was there.
It's just such a poor nation, and so many places don't have running water, and these children haul water for miles just with their little bodies. So I know that God is going to do a work in that nation when the hearts and minds of people change toward children. I believe that a blessing will come upon that nation so that poverty can be turned around.
What does God say about the little children?
Let them come unto me.
That's right. And we want you to know that if you want to give, you go to the website, Chris.
ChrisFreeTN.com, and we'll have links to the website.
Sites where they can get to it.
And how they can donate and find out more about it.
Yeah. Great. And thank you so much. And I hope that you have been of interest, this has been of interest to you today in what Sandra Kay and Tammy are doing. And it's awakened my heart again to what Haiti really is like and what's there. And thank you for being on. Thank you. I hope you get so much money coming in. It's unreal. And you have a blessed day, and may your project go well. And also to run, remember 5K. It is not 5 miles. Just be sure you know that so you can run. We'll be right back in just a moment. Thank you.
Thanks so much, Kay.
Kyle Motors, 802 20th Street Southeast in Cleveland, is the place to find quality pre-owned cars and trucks. Kyle offers on-the-spot financing on all vehicles on the lot. Each pre-owned vehicle goes through a complete inspection to make sure each car and truck meets the Kyle Motors standard. Warranty and extended warranties available on all vehicles. Kyle Motors will sell you a car or truck that you will be proud to drive for many years to come. See Tony, Bill, Dale, James, or David and let them put you in your next quality pre-owned vehicle. Kyle Motors, 802 20th Street Southeast. Phone 790-7100.
At Crawford Pharmacy, we offer custom compounding. Our pharmacists are known for their attention to detail and unique expertise. So visit us at 2260 Chambliss Avenue, Cleveland, Tennessee. For personal assistance, walk right in or come up to our convenient drive-thru. Crawford Pharmacy, serving our community one person at a time.
Americana, where trucks are big and bold, and a handshake is firm, and your word is gold. Don Ledford Chevy Buick GMC in Athens is a $2,000 drive. Maybe you're coming from here or here, doesn't matter. Buying a truck from Don Ledford in Athens will save you at least $2,000 bucks. Don Ledford Chevy Buick GMC in Athens, a $2,000 drive worth making.
I'll take that drive every time.
This segment of Tennessee Valley This Morning is brought to you by Crown Chrysler Dodge Jeep and Ram, located at 511 South Lee Highway in Cleveland and 2120 Chapman Road, Chattanooga. For your next new or previously owned vehicle, make it Crown Chrysler Dodge Jeep and Ram, the better way to buy.
Hey, welcome back to Tennessee Valley This Morning, and of course we have a new person in the chair beside of me, and that would be Miss Ruthie, Sergeant Ruthie Forgy from the Salvation Army, and it's coming up how many days till Christmas?
50 days from Christmas from today.
That's right. So we've got bells jingling, and we've got angel trees, and we've got the jingle bell jog, and we've got all that kind of thing that we're going to talk about today. So where you want to start? What's the most, where's priority today?
Hey, you know, it is the most wonderful time of the year. So,
I know.
Kettle Kickoff is this Saturday at Bradley Square Mall, Center Stage. We will be having our Kettle Kickoff with Mayor Tom Rowland and his wife Sandra coming to donate the first donation in the bucket. And we'll have lots of entertainment there. We have a little drum line from our corps that's going to be there with their buckets, 5-gallon buckets that they have learned to play drums on. It's really fascinating, actually. And our dance team will be there, and then our youth will be there with the praise and worship team. So really looking forward to that.
I know, and I'm going to miss it this year.
I know, you emceed it last
I
year
know,
and did such a wonderful job.
Well, you called me to do it this year, and I already had. I'm going to judge POF at Lee. So
you have more fun with us.
I know, but and it's shorter time.
And shorter, just an hour. So
I know.
Yes.
We gave out the door prizes last year. Will you have door prizes this year?
Yes, we will.
So you all want to go, and the mall. I mean, the mall looks great too, doesn't it?
Oh,
they've
the
rearranged
mall
all
looks
of that.
phenomenal.
So
yeah.
you all want to go, and the door prizes are great. So
yeah, come be a part of it. We'd love to
Yes.
have you come
Yeah.
and help us kick off the season.
Yeah, and I asked her a little while ago, how many bell ringers do you need? She said a lot.
Yeah, we have about 26 locations here in Cleveland and also McMinn County and Athens, I believe, is that McMinn. So yeah, we have taken applications and we'll be receiving applications through the end of this week. So if you are needing a seasonal job or just some part-time employment or just needing to supplement your income a little bit during the holidays, just come on by our office at 437 Inman Street. And we'll have applications there for you and hopefully get you out ringing a bell this year.
Yeah, and then, of course, we do volunteers that ring the bell.
We do. We are very, very blessed in this area to have so many people who generously want to just devote an hour or 2 hours or half a day to ring a bell. So if you and your family want to come and be a part of that, just go to our website at csaarmy.org. And you will be able to have an opportunity there to sign up to volunteer, and we can get you out. I know the first year Kay did that. She said that was the best part of her Christmas.
I know. I love ringing the bell. The first time I went, I was just kind of embarrassed. I thought, oh gosh, here I am out here ringing a bell. You know, I had never done anything like that before. And so I arrived, and I had the best time, and so I do it every year.
Every year now, and
Yeah.
actually now you coordinate a whole team for a whole
I
day.
do,
So,
and it's fun. And if they don't show up, I
you ring
it the second hour, or the third hour, or whatever. But and you mentioned family. If you'd like your family to ring the bell, you just would not know how many family members get together. And do the children enjoy it, Chris?
Yes, they do. They
Yeah,
really
Chris's
do.
children did
my
last
kids helped
year.
out last year and really enjoyed it. I mean, you just really get.
It's fun. You get in the spirit of being polite to people, being nice to people, and what is so interesting, and we've talked about this before, is if people don't want to give, they won't look at you. They just kind of go, and we want to speak to you anyway.
Yeah.
We just want to say, hi, Merry Christmas. If you don't have it to give, not a big deal, because we just want to be nice to you. We're not being nice just to get your money. We just want you to have a nice day and a happy day,
Yes.
because you may have given money before.
Correct.
And a lot of times people say, well, I just gave at the other another location. That's great. We just want to wish you a Merry Christmas.
Yes, correct. You know, it is the season of cheer and Thanksgiving, of gratitude, of just remembering what it's all about. You know, that Christ came and He was the gift of
That's
all
right.
gifts.
Right.
And to really just be able to celebrate that, and it's just Christmas is just a time where there's a collective feeling of goodness.
And you know, I always like to bring this in, and it meant so much to me the first time I heard that in the Bible it doesn't talk about the giver or the receiver ever being blessed anymore than what they receive that day. But the giver that gives is blessed over and over and over again.
Yes.
So when you give, even if you don't have the money to put in the pot, give of your time, because we need that just as much as we need the money's being given in the pot. So, and if you want to be on somebody's team and work, we have a team, so give me a call.
You got 2 teams.
I have 2 teams. Well, yeah, I do. I have 2 teams. So if you want to work on my days, I would love to have you to work with me. So just give us a call and we'll set up a schedule and get it all worked out. But or if you know someone else that has a team, if your Sunday school class or your sorority or your business or anyone would like to take one day or so many hours, we love that, because
Yes.
it kind of gets competitive, doesn't it?
We do. We have some friendly competition going when you're between the Rotary clubs and Kiwanis, and we always
Yeah.
like to see who can raise the most, and it's just a good friendly competition.
It is. It's a lot of fun, and a lot of people are get involved in it. So if you're interested, you might want to get your name in early because we may just fill it up.
Well, and I think it's important too, a bell in my hand is just a bell. But a bell in a volunteer's hand or one of my kettle workers' hand, it is a hot meal for somebody who's hungry. It's a warm blanket for somebody that's cold. It's clothing for somebody who's just really down on their luck. So in my hand it's a bell, but in your hand it is hope.
It's a blessing to
It's
someone.
a hope for someone
Yeah.
else. So yeah, I love kettle season. I'm one of the few officers who just love kettle season. I look forward to it. It's very hectic. It's very fast paced. But it's a wonderful, wonderful time, and blessed to be able to do it.
Let me say a compliment to you because she loves it so well. It makes people like me and others that participate in the program love it. And it brings that excitement and that enjoyment and that blessed feeling of ringing the bell.
Yeah.
But if you didn't like it and didn't share that, because it all comes down from the top, right?
Right.
It all
That's what they
starts at
say.
the top. And she loves it, and she's out there, and when you least expect it, she's driving by and saying,
Waving.
"Hey, how are you?" And is everything going all right? So
Or coming to get your kettle because it's so full.
Yes.
So sometimes those kettles get full. We love it. When
They
I get
do.
a call that my kettle's full, I'm like, okay, good, I'll be right there.
I know. So it's great. You want to talk about what now?
We have Angel Tree. Many of you are familiar with our Angel Tree program where families where we have authenticated need come in and fill an application for help with their children who need help with Christmas. For children 12 and under, we are taking applications the rest of this week and through next Thursday, Tuesday and Thursday, Tuesday through Thursday of this week and Tuesday through Thursday of next week from 9 to 6. If you call our office to get an appointment, it's 423-308-3467. You can schedule an appointment, and we'd love for you to come and fill out an application if you need some help with your children. And also, we need angels to adopt those children.
Yes.
To go to Kmart coming this Friday and Saturday. The angels will go on the tree, the angel tags will. And if you want to go adopt an angel, please go by there, and we'll have people there to sign out an angel for you. Or if you're a group or a corporation and you want to do a group of angels, then just, again, you can call our office or go on the website csa.army.org and be able to get information on how to adopt an angel. And last year, I think we had 864 kids that needed to be adopted, and each year it seems the need goes up a little bit more. So we're expecting, that plus, at least 75 to 100 more than we did last year. So need all the help we can get. And again, we've never had an angel that hadn't gotten adopted in our community, which is pretty amazing.
That's amazing. I have a question. When they take the angel off of the tree, and there's a list of things for that child, are they to buy everything on that list, or portions of that list, or how do you?
Basically, they can. There's a list of wants and needs, I believe, and you can choose what you want on that list. You don't have to get everything on the list because we go through and ask them for their coat size, their shoe size, their clothes.
And when I did it, I thought I was supposed to get everything, and I was out shopping. I'm thinking, dear Lord, I don't buy this much for my real kids. And then someone said, no, okay, you choose. That's the reason I was asking the question. So if you get one, and there is a long list on there, I tried to buy at least a portion of it in the wants,
yes,
and then a portion in the needs.
Yes, yes.
And so that helped me, but I wanted to make that clear because if you're going out to get that, I had no clue. I'd never gotten one before, and I was just shopping. I had coats and shoes and
everything.
Everything.
Because we do. We try to get what they, and if there's a real need like a coat, we'll highlight that because sometimes there are, and particularly with a single mom with more than one child in the home, a coat may be a real need because kids grow. They don't wear the same coat from season to season like a weekend after we get adults.
Well, I had a little girl last year, and I bought her things that I would have bought my own little girl. I don't know, you probably don't remember what I brought in, and that's okay, but I had this little coat with fur on it, and the boots with fur to match. I mean, I just thought, you know what, I don't know how practical it is, but at least this child is going to be excited at Christmas.
And feel special.
And feels like probably so special. And she may never remember, she may never forget what she got this Christmas. But it was fun for me to do that. You know.
Yeah, I remember one of my favorite memories from Angel Trees, because we also have senior angels, and we had a 74-year-old lady who wanted a purple bicycle. And we got her that purple bicycle, or the angel that the person who adopted her got her that purple bicycle. Okay, it was like her getting $1 million when she came and saw that purple bicycle. Okay, that was my best moment of Christmas.
Isn't it
that
something?
year? I mean, it was just wonderful. So, and also, you know, we use volunteers all through the season, not just at kettle stands, but also an Angel Tree. We have an Angel Tree warehouse where the gifts have to come in and be sorted and accounted for, and just really taken care of. It's a very big system. You'd be surprised, but you know, to make sure that we get everything to every child. If you buy it for that child, it goes to that child. And so getting all that sorted, and you're welcome to come and help at the Angel Tree warehouse. And if you can be there on the day of distribution, day of distribution is wonderful. We ask the parents to come and not bring their children, because distribution day is before Christmas. But to see the parents come in, and sometimes they are so overwhelmed that they are just in tears at the generosity of the people who live in here in this community that want to help take care of children on Christmas, or even our seniors. So if you want to volunteer and have some time, I believe distribution date this year is the 19th of December. And if you want to help with that, we'd love to have you come and help with that.
Give them a phone number where they can call the Salvation Army if they want to.
Yeah, if you want to volunteer for bells or for kettles, Angel Tree, the number's 423-308-3467. And you can ask for me, Ruthie Forgy, or for Jim Welch, who is a coordinator of Angel Tree this year.
Okay, and Chris will have that information also on the website.
That's right.
And so you can come to that. It's chrisfreetn.com. So I'm memorizing that. We just have like a minute or so, and I want to thank you for being here. We didn't get to talk about Jingle Bell Jog, but maybe Jim will come on and talk to us about it.
Jim will come and talk to you about it.
I'll have Jim to come back and talk to us about Jingle Bell Jog, because that's his program.
Yes.
And we'll have him to come back. But Ruthie, thank you so much.
Thank you for having us again.
It's always a pleasure to have her and what's going on at the Salvation Army. And believe me, they have a lot going on.
Yes.
They do.
We do.
And I thank you for the opportunity of serving with you. And
we love it. You and Chris both are on our board, and we love having you on our board.
Well, we love working with you. And we hope you have a blessed week, and enjoy the day today and this nice brisk weather that we have. And we will be seeing you in the morning at 6:30. I won't be here, but somebody will be here for your program. So have a good day.